Hi, I'm Zuzanna Lutrzykowska. I am an MD PhD student at the University of Michigan. I'm in the third year of the program. My PhD is in philosophy, more generally. I am interested in questions at the intersection of ethics and medicine, but that has a very broad range. I'm interested in the interpersonal relationships between patient and physician, but especially through this summer academy, I've become interested in these more macro type questions. One that I'm particularly excited about is about defining the boundaries of medicine and of medical institutions, right? We talk about healthcare inequality, we talk about the ethical allocation of healthcare, but what even is that? How should we figure out what belongs in that category? What is healthcare responsible for? And so that's something that I've been thinking about a lot, whether we should even try to draw these boundaries, whether things like social determinants of health should be considered as something distinct from medicine and medical care, or whether that should be something that as a future medical professional, I should be worried about in the sense of my own practice, not merely as some kind of externality that affects my patient's care. I think that for this kind of work, empirical evidence and studies are going to be really helpful, but I can imagine that getting that kind of information over the long term, especially as healthcare systems continue to change, might be a challenge, but I feel like it's also going to be very interesting to see that as policies change, how can we as medical professionals work within that policy to change it to help our patients do better, but also what does that do when it comes to thinking about medicine more generally? Because there's a lot of intertalk, of course, between these broader questions about policy and about the way that we live that of course influences our health. So seeing how that changes over time, hopefully in a direction that supports people more going forward, I'm really interested to see how that's going to influence my work. So I think that these types of summer programs where we get to talk with people at very different spots, not only geographically throughout the world, but also in different areas of expertise has been incredibly helpful. So folks who are really knowledgeable about policy and how policy change happens, interacting with physicians who are there on the ground, able to see in real life the effects of their work and of these policies, how they're enacted and enforced, who are also talking with lawyers, who are also talking with economists and scientists and philosophers, of course. I think that is going to be really helpful going forward. But then, of course, raising the voices of the people who are facing inequality the most, getting their narrative and their viewpoints and their real struggles, bringing that to the forefront and listening and responding to them, I think that should be directing our work at the end of the day, even more so than just experts talking with one another. We need to hear from the people who are going to be affected the most by our work. I think the biggest thing is seeing all of my peers and colleagues. I'm somebody who's pretty new to the kind of academic circle on this level, I guess, and seeing so many other young people who are passionate and interested and intelligent and caring, deeply caring, is very inspiring to me, and it brings a lot of hope. I think that there's a lot of powers in the world right now that want us to be pessimistic, want us to be in despair, but I think it's courageous to be hopeful.